Hello. Have you or someone you've known ever suffered from a diabetic foot ulcer or bed sore? Millions of people have. Here in the US, 110,000 amputations a year translate to 250 a day in the US alone. It's a leading reason people with diabetes end up hospitalized. Dr. Pelkis, founder of IYIA Technologies and developer of the O2Misly Wound Treatment System. Our FDA-cleared and patented wound treatment system is for the treatment of chronic wounds such as foot ulcers and bed sores that plague millions of Americans here in the US and cost us billions of dollars. We believe if doctors will use the O2Misly wound treatment process, it'll save these people's limbs and lives. O2Misly delivers vaporous hyperoxia therapy, a new treatment that we've discovered is far more effective than anything that's been tried before. Vaporous hyperoxia therapy is a combination treatment that delivers the essentials for wound healing: hydration and oxygenation. This combination process, hydration and oxygenation, is done in 15 minutes and repeated over 4 times in 1 hour in a doctor's office or in a home setting. As for examples of some of our results, this patient in his 40s has been diabetic most of his life since teenage. He's on weekly dialysis treatments and taking insulin. After years, his wound hasn't healed, which has prevented him from being a candidate for further surgeries such as a kidney transplant. After 12 of our treatments, in 6 weeks, the wound was completely healed. The patient became a transplant patient, not only receiving new kidneys, but also receiving new pancreas. And in his testimony, attests to how, if it wasn't for our treatments, he would still be getting his dialysis and insulin shots. This story was reported in Diabetes Health magazine. A much larger wound. This was on an 80-year-old invalid who had a 98-millimeter gash across the back of his ankle. The doctor that treated this in his 4 decades had never expected this wound would in fact heal. It was scheduled for amputation, but it did heal after 22 weeks of treatment. In a recent dramatic case of a bed sore, the O2Misly system was used on a patient that had been in bed 30 years from falling off of a power line. He was a bilateral amputee. In the last 8 years, he had developed a bed sore. 248 cubic centimeters, it's about the size of a baseball, was missing from his right buttock. 8 years of treatments, the wound was getting worse and worse. In fact, the gentleman was dying from antibiotics and the infections that were in his wound. Dr. John Chain here in San Diego prescribed the O2Misly, and after 2 years of treatment, the wound, the bed sore, was healed. During this time, a secondary wound on the patient's left side had opened to the point of 120 cubic centimeters. That wound healed within 1 year of treatment. The O2Misly is designed for home or office use. Here in this photo, it's shown in a podiatrist setting with a patient relaxing comfortably in an exam chair, the foot suspended in the disposable bag. For use in bed, an exit tube is attached with a bag that surrounds the affected area. The results of our study are amazing. After nearly 30 patients were tested, 90% were healing at the 20-week mark, nearly 3 times greater than you would find with any other standard of care or any other process. A p-value indicating the process is proven itself effective of 0.001 translates to less than 1 in 10,000 chance our statistics are in error. So from what we have seen, we believe vaporous hyperoxia therapy should become the new standard of wound care for the treatment of chronic wounds. We believe using this will prevent thousands of amputations and save lives from chronic wounds. O2Misly is 3 times more effective than the standard of care at the 12-week mark or at the 20-week mark. The O2Misly Wound Treatment System by IYIA Technologies, to save thousands of limbs, to better millions of lives, to save billions of dollars.